Well, welcome everyone to the April Statistics Former Student Network webinar. We're very fortunate to have with us today Dr. Dennis King. Dr. King received his PhD in statistics in 1988 under his advisor, Dr. Michael Longnecker. Dr. King was the founder and president of STATKING Clinical Services, a contract research organization located in Cincinnati, Ohio, from 1989 until the sale of the company in December of 2020. His most outstanding accomplishment in his career was the building of STATKING into a nationally known and marketed full-service CRO. His management expertise in the areas of clinical process implementation, contracting of CRO services, and sales and marketing were instrumental into the success of the company. He has sold millions of dollars of CRO services over the past 3 decades and the operation of STATKING Clinical Services. He and his staff have provided clinical trial services on more than 450 clinical trials for drugs and medical devices. STATKING was honored by the TMU School of Business as being one of the top 100 Aggie-owned companies in terms of net income gained for the years 2019 and 2020. Dr. King was the 2001 recipient of the H.O. Hartley Award, and he's also authored or co-authored more than 40 technical papers in a number of scientific journals. His expertise in the use of SAS software consists of SAS programming for all types of statistical methods. So welcome, everyone, and thank you, Dr. King. Please take it away.
Great. Well, thank you, Marcy. That's a very nice introduction. I appreciate that. I appreciate you all being on today, and I'm going to go through some of my career highlights and give you some stories of some interesting things that happened to me over the last 25 to 30 years. So if you put it all on one slide, I guess this one is it. This is kind of my career summary. And I got into statistics kind of by mistake, I guess. I didn't really know that there were even statistics jobs available. I went to Eastern Illinois University for undergrad, and my advisor, my senior year, I had taken a couple of stat courses, and he suggested, well, maybe you ought to go to grad school in statistics. And I didn't even know for sure what that was at that point. But I took his advice and I started to apply to some of the grad schools, and University of Wyoming was one of the first ones who offered me assistantship, and not knowing much about what the heck was going on, I took it right away. And so I went on to Wyoming and got master's there, and worked in statistics there, as well as went on to University of Arkansas, and it goes down the page there. I was a lecturer for 1 year in the decision science department at Miami University. That was right after we had moved to Cincinnati. But I only did that for a short time and then started StatKing, and I'm going to tell you a lot more about that process over the next few slides. I will stop early, because I know some of you will have questions about some of the things I've done. So I'll stop early. Can everybody see the slides? Are we good with that?
Yes, we're good.
Okay, Anna. Okay, so my first job in statistics was to work in the Ag Stat lab at University of Wyoming. So I went there for a master's degree, and I worked under Glenn Rohrkassi, who was the director of the Ag Stat lab. And we did a few projects a year, thank goodness, because I needed all the other time for grad school. Most of it was data analysis and SAS programming, and most of it was analysis of variance and linear models type stuff. Interestingly enough, we were on cards in those days, which meant we had to take one of our main jobs was taking the computer cards over to the computer center to be read into the computer, and going and getting the outputs and bringing them back from computer center. So it was a really archaic setup. Dr. Rohrkassi actually had Fortran programs that did a lot of the ANOVA calculations, and he had a separate program for one-way ANOVA, two-way ANOVA, etc. So it's kind of a weird setup. He had just started using SAS, and so we'd converted some of the programs to SAS, but that was my very minimal introduction to actually doing something to help people on their projects. And so we only worked on about 10 projects a year at Wyoming while I was there getting masters. Got my master's in 80 and went on to work for Dr. David Marks, who was the director of the stat library in the College of Agriculture at University of Arkansas. And there I started to broaden out my stat experience. We consulted on about 100 projects a year there. And we had 4 other people that were essentially masters in statistics working on these things. And Dr. Marks was our leader. And most of that was field experiments in cotton, rice, a variety of ag products in the ag college. And so a lot of it was experimental design, block designs, incomplete blocks, Latin squares, lattice design, split plots, strip split plots, etc. And again, mostly linear models. We talked a lot about mean separation techniques. And there, SAS was on a time sharing system, and I'd never used a time sharing system. So my instructor for that was Carol Andrews, and she was actually an animal science major. And so it was a really weird deal, because I came there thinking I was going to be some kind of an expert in stats and helping these people. And in fact, the animal science people knew more about it than I did. So, but Carol was a great teacher, and I started using SAS in the time sharing system, and started helping the grad students first, and then finally the ag professors. And we also worked in weed science and animal science and some of the other departments in the College of Agriculture. And we started using SAS on the PC. So, it was archaic at first. Again, we can only run 1 or 2 way ANOVA to start with. We use SAS stats, SAS graph, SAS ML, and SAS macro language. So that 5 years was kind of where I really started to use SAS all the time, every single day, try to push it to the limit in terms of what it would do, and make sure I understood what it was doing relative to all of the different statistical things that we were doing. So it was a real formative time for me in terms of learning how to consult, learning how to help people, and learning what SAS was doing, which itself became a new field, so to speak, in terms of our education. It wasn't just about the courses anymore. It was also about how do you do something with what you've learned in terms of the stuff that you learn in the books about linear models. But how do you do that? How do you actually make it analyze data? And so that kind of became a long-term thing for me in terms of learning about SAS and really understanding statistically what they were doing, some of the things that you had to really dig down in the literature to understand how they were computing things. But that kind of became my forte after a while in terms of doing that. So then we we took our 2 young children and went back to get a PhD at Texas A&M University. My wife and I have always questioned that we were crazy at that point, but we did. And we came back in 1985, and I worked with several A&M faculty there. I actually was a research associate, and my job was to consult with people. And so this was like a tremendous educational thing for me, because I was seeing about 350 people a year. Now, granted, we couldn't help anybody too much. Sometimes it was just a 1-hour meeting, but I saw a gamut of stuff in agriculture, medical. These people were coming from all over campus. We even had people coming from the branch campuses to get help. We finally had to stop that, because it was people over the state of Texas coming to get help from us. And so we worked on a ton of projects. I really got a wide gamut of stuff with SAS and the statistical methods that went along with it. And so I just listed some of these here. We did a lot of multivariate stuff, a lot of experimental design, of course, still. And we even did some time series stuff. So it was a really great introduction to everything in statistics, and really set me up to be a consultant. During that time, I kind of veered away. I had originally thought I would teach at A&M maybe, or some university, but as time went on, I became more and more versed at how to help people. There was kind of a mantra to that as well: how to help people, what level to help them at, and coupled with my SAS knowledge, why I decided that I would definitely want to be in consulting at that point. And of course, in that point now, we're using SAS on larger and larger microcomputers, and some small local area network usage of SAS. So SAS was evolving during this period as well. And that knowledge was key in terms of being able to help people. So in 1988, I got my PhD, and so I started STATKING as STATKING Consulting in 1989 in an office in my house. And people, I put these two questions down because these are the two most asked questions I always get. And that's, how did I fund the company? And then how did I name the company? And they both have an interesting story. So in terms of funding, in 1988, in the summer, Texas A&M, I would get my paycheck each month as a grad student, and Texas A&M had taken out some money that was about $250 that shouldn't have been taken out of my check. And of course, in those days as a grad student, you need every buck you could lay your hands on. So I was really upset about that. And I went to Ruth Hansen. Some of you will remember Ruth Hansen. She was the admin in the stat department for years and years. And I told her about this problem, and she said, I'll look into it. So long about November of 1989, this was a year, more than a year, 15 months later, the check for $250 shows up at my house. And so I thought it was kind of just kismet or something. And so I used that check to start the account for STATKING Consulting. So it wasn't a big funding thing. It didn't go to venture caps and get millions of dollars. It just put $250 in the bank, and we were launched. But Ruth, good old Ruth, she came through as she always did when we were all there for us. But it was 15 months later, and frankly, I even forgot about the money at that point. But anyway, that's how I funded the company. How did I name the company is another interesting story. My friend from undergrad, my roommate, was Ray Long. And I don't know if any of you have heard of Ray, but he's a Pulitzer Prize winning journalist for the Chicago Tribune. And he's been in on Illinois politics for years. He has a new book out about Illinois politics, and he is an incredible journalist. But he was sitting in my office at Texas A&M there in 1988, and somebody was in there asking for help, and they wanted to know who they had to see. And good old Ray says, "Oh, you need to see Dennis. He's the Stat King." And so that name kind of stuck with me. And when I started the company, I was like, "Hey, we got to call it Stat King," because of course Ray was also wanting a royalty off of this for helping me name the company. But anyway, Ray Long is the instigator of the Stat King name, and that's kind of stuck with me through the whole of my career. When I started the company, again, a little bit of everything: clinical trial design, protocol development, data analysis, SAS expertise, all the things that you see there. A little bit different types of statistical methods because we were starting to work in clinical trials, but moreover, trials for non-regulated products. So the emphasis changed, but and I did all this out of a room that we set up as my office in the house. So I listed some of the steps here in starting StatKing, and there's several steps to starting a business, obviously, incorporating, et cetera, et cetera. But the the reason I set up this slide was these were the things that I did in this order. And I think that they are completely backwards because that last bullet is the most important. It should have been the first thing that I did, because as I've learned over the years, if you don't sell something, you haven't got a company. And so, I set up all this stuff, and it was like, okay, well, I'll put out my shingle and everybody will just start calling me. Well, that didn't happen, of course. And I had to start going out and meeting with people and trying to get people to come to me for statistics help. So it was kind of it's kind of a backwards way to start a business. But these were some of the beginning minor steps that I took to get started. And as I grew the business a little bit over the first couple of years, I had hired an employee to help me with getting payroll run and just taking care of a lot of details that have to be taken care of each day while I was out trying to get consulting money and trying to get money in the bank. So Kathleen was my first employee, and she came to our house for a while, but we learned at that point, we couldn't have people come into the house, and it looked like we might have to hire another person. And so that's when we moved to our offices uptown in Fairfield. And so this was kind of the first 3 years was kind of the initiation period of getting this thing started, getting it off the ground, and then starting to hire employees. So then these are the types of things these are the steps in the progression. We started advertising more. After the first 3 or 4 years, we learned that if you don't sell something, you haven't got a company. And so we started with mass marketing. We tried mail outs. We had to try to learn our market. We weren't even sure who we were competing against at first. We knew other statisticians who consulted, but again, it just wasn't clear where we were headed. We're adding more employees. We had 2 or 3 more employees, and we moved offices uptown in Fairfield. Most of our work was with non-regulated products at that point: toothbrushes, toothpaste, a lot of different things that you use all over the counter each day. We did a lot of work. At one point we had all 3 of the major dental companies worked with us. Colgate worked with us. The Procter & Gamble people worked with us some. Oral-B in California worked with us a lot. And so we had all the major players in the oral care game. We bought our first large central server, and one day in 1997, Procter & Gamble's people came to us and said, "Hey, we need some SAS programming done on a clinical trial. Would you be able to do that?" And we said yes. At that point, we had about 5 to 7 employees. We said yes. And when they said what they were willing to pay us to do that, we were like, we've got to get out of non-regulated products and get into regulated products. And so Rod Lashley, my partner, who I'll talk about a little bit more here in a second, he and I made the decision to change the company over to working on regulated products clinical trials at that point. I think that was about 1996 or 7. So these next 2 slides are kind of a timeline of STATKING and how we progressed. And let me just go over this briefly, and then I'll drill down on some things that I want to talk about. I guess the first bullet point that I want to talk about is that 4th category over there. In 1994, I hired Rod Lashley, and Rod Lashley became my business partner and my sidekick, and now he's my golf partner. And that's a funny story as well, because we met on the softball field. In Fairfield, there's about 15 to 20 T-ball teams of 5- and 6-year-old boys and girls. They play together. And there was a man named Alan Blair, who has absolutely nothing to do with my story except this little part. And Alan had gone around and found all of the good female softball players, because at the 7-year-old age level, they had a draft in which they could draft players. And so Alan Blair had gone around and scouted every girl's player on all the 15 to 20 T-ball teams. And he had come to me and asked me if Annie, my daughter, would be willing to play for him. And he'd done the same with Allison, his daughter. And so Allison and Annie became good buddies on the softball team at 7 years old. And Rod and I started helping Alan coach that team. And so that's how Rod and I met. He was working in Dayton, and he didn't like driving up there every day. He was a SAS programmer, and he wanted another job. And I said, "Why don't you come to work for me? We're right here in Fairfield." And that was the start of a great partnership that lasted for the whole rest of the STATKING time period. So as you can see here, we added data management services as slowly as Rod came on and got up to speed. And so at that point, we started to branch out on services, and we decided to rename the company STATKING Clinical Services. Now, we did that one day with saying, "Hey, let's change the name to STATKING Clinical Services," not thinking that some of the problems that would cause in terms of advertising and brand name recognition and blah, blah, blah. But we did it anyway, and actually it didn't turn out that bad. We finally got known as STATKING Clinical Services because we were branching out in services. And then as you look at the second half of this timeline, the number of employees was increasing. We were up about 25 employees when we sold the company. And you can see that we got into data management, that we got into monitoring, got into medical writing, then clinical trial management, and all of these services that we continued to add as we went along to become a full service CRO. We didn't do it overnight. It took about, I would say, a 9 to 10 year period to actually convert STATKING Consulting over to STATKING Clinical Services, where we were known across the country as a reliable CRO for doing clinical trials for medical device and drugs companies. So this slide shows a little bit more of the bullet points. As we started to branch out, we expanded to a full service contract research organization. If you all are not familiar with the CRO services game, most studies by drug companies and device companies are done by CROs. They're not actually conducted by the company. They hire CROs to run the trial and to oversee the trial, make sure the data is collected, analyze the data, and get everything ready to be sent into FDA to try to get an approval for the product. So this may involve one to many studies that are combined, and so we started doing all those things. I mean, data analysis and statistics came natural to Rod and I, and so we started doing those steps first. But then we realized that we had to get into other steps and other services. So bidding and contracts became my forte and Rod's, because that was, again, the whole game. Once we sold something, we had to bid on most things that we got, and so you had to provide competitive bids, and there was a whole mess of issues with that. And probably the greatest challenge in trying to cost anything was SAS programming, because it's just so unpredictable how many hours it might take to do something. Things that look so simple up front were really hard to do and involved way more hours than we had contracted for, and we couldn't go back to get out of scope for stuff that was our mistake. I mean, we just had to live with that. Rod and I became the salesman of statistics. We traveled all over this country. We were gone about 50% of the time. We covered about 20 states. We couldn't even cover the whole United States. Rod covered the East and did a lot of traveling there, and I covered from Texas on west. And we mostly visited business incubators. Most of our clients are ones you have not heard of. They have one or two products, and they were just growing themselves. They were run by entrepreneurs who had received venture cap funding. And so that's where most of our clients were. And so that's where we traveled, was around to the business incubators in these various states. So we were regional sales. We only had 2 of us though doing it. And we finally tried to hire other salesmen. And that was hot and cold in terms of trying to find a salesman who knew enough about CRO services to sell those services. Also during this time, we established all of our training programs. We had to be trained for FDA regulations, onboarding. We had to have a lot of SAS training. Of course, there was SAS had a big training operation, so we could send our people directly to that. And then as we started to get more and more people on, and we had managers, we had to provide management training for these people. So we had to develop courses in that. Again, we had contract course services that we could go to. So that worked out pretty well. And then Rod was my crutch, that he helped so much, and he did so many things. He set up all the employee benefit programs, all the computing facilities maintenance. He helped me do sales, and he helped set up the training and did all the finance stuff, and interacted with all of the contractors that we had to pay the payroll and maintain the building, and et cetera, et cetera. And Rod took care of all that. We had contract computing folks to help us with the servers and keeping them running, and Rod managed all that as well. So this is where we wound up. And at the end of the road, we were doing all of these clinical study services. And what we had to do was depend on our employees that we would hire, for instance, in clinical study monitoring, to tell us what the steps were in that, so that we could list them out and start crafting our bids to cover these steps. And we had some great employees who went on to great things after they left STATKING. I mean, some of these people wound up in management and CROs, some of these highly awarded employees. We had some really great ones. And that's how we did it. We just tried to learn from them what were the steps in clinical study monitoring, for instance, and we would write out those steps, make sure we had them all, and then we'd start assigning hours to those. And of course, then after you did that, you had to decide what kind of a price point am I going to use for each of these study services. And that was hit and miss. Sometimes we'd underbid, but sometimes we'd overbid. And so it all kind of had a mean level in terms of the bidding that kept us afloat all those years. But all these things were things that we got into. And of course, we didn't know anything about those. Neither Rod or I never worked in a CRO before. So we had to learn everything from the ground up. But actually, that wasn't such a bad thing. And so this is what our study services looked like when we sold the company. And then this is what the org chart looked like. So we had programmers under statistical programming head, biostatisticians under the biostats head. Under clinical trial management, we had medical writing and site and lab management and medical mar. They all reported to the trial management people. And then clinical study monitoring, we had a head for that and a head for data management. And Rod and I basically were the C-level people and the only people in overall management. But we had a manager for each of these services, with the exception of medical writing, site and lab management, medical monitoring. They were all under clinical trial management because they were so highly linked to clinical trial management. So it was, we built the company out over time. It took a long time. This was a 20-year period that this all happened, and we was slow. We'd have to get into an area of service, and then we have to try to convince somebody to go with us, having had no experience in that level of service, although our employees did. And that's really what the key was hiring good employees who had done some of these things. And then they had contacts that got us into sales of these services to these companies. And then once we'd done a couple, 2 or 3, we got to the point where we were experienced enough to be able to sell it to other people. But it was an uphill battle in terms of sales for all those years. So then the end of the road came. Rod and I had decided we wanted to retire. And so we decided we were going to sell the business. Well, that turned out to be a 3-year process. We thought, wow, that might not be too hard, but it wasn't. It was very, very difficult. And we hired a business consultant, but unfortunately, he didn't have a large scope. And our company is so niche that it's hard to find buyers, or at least it was for him. But we did manage to establish the company worth, and we were learning about profit and loss statements and balance sheets. Again, Rod and I never had any business training, so we were learning from the ground up, but he taught us a lot. And then we went away from him and took on a larger business sales consulting team, and they had a lot more outreach across the planet of potential buyers for our company. And so we negotiated with multiple buyers for the company. And then we completed the sale at the end of 2020. And we had a cast of thousands finally to get that done. And it with all the paperwork and everything that had been done, and it actually did come down to the very last day of 2020 when we finally completed everything and signed off the forms and completed the sale. But it was an interesting 3 years in trying to get that done, because again, like the services for the CRO, we had never done this before. And so we were learning a whole lot about what was worth in terms of our company and what the buyers were looking for. So that leads me to today, which is I'm retired now and have been for 3 years, since 2020. And so my major profession now, as I tell everybody, is playing golf every day. And so I have to apologize. I did wear my Wyoming stuff in this picture that I have on here. I should have worn my Texas A&M stuff that day, but I happen to have on all my Wyoming stuff that day. And then keeping the grandkids. We have 4 grandchildren, and then visiting my 2 daughters and their families. We have 1 daughter in Chicago and 1 in Pittsburgh. And so that last picture there is our extended family. And of course, my wife, Eileen, I have to mention, because she is also a highly respected statistician who has accomplished so much in her career. And we've been together since we met at grad school in Wyoming, and been married ever since. And she is just about to retire, and she has spoken to this group, and she's got a very interesting career story as well, and has done so many great things. So let me stop there. I'm sure some of you have questions, and be happy to take those, and talk a little bit more about some of these things more in depth.
Thank you, Dr. King. That's an awesome story. I think I might have come to visit you somewhere along the way in those early days in Cincinnati. In my early career too, and this sort of all drives home a very similar career path for myself. So it's real interesting.
I know you and I are similar.
real interesting to hear you had some of the same trials and tribulations as I did. But I do think it's quite interesting for our students in particular, those who can learn about careers that, early, right after graduation, and then how you can take those ideas that you have in your head and really run with them and really make something big out of it. And I think you've been very successful there. I'd like to open the floor to questions, though. If there's anybody in the audience who would have a question, you can either raise your hand or send me a note in the chat, speak up. Any of those things work.
I have a question. This is Byron Gajewski.
Sure.
Um, so I enjoyed your talk, Dennis. It's very enlightening and brought back some memories with talking about Ruth and Mike Longnecker for me. So did I get this timeline right? Did you grow up in Illinois?
Yeah, that's correct. Yeah, I'm from West Central Illinois originally, and I went to Eastern Illinois. Well, I actually went to Eastern my second 2 years. I went to Illinois College in Jacksonville for the first 2 years.
Yeah, I didn't grow up in Texas either. I grew up in Alaska. Got to, as they say, got to Texas as quickly as I could. But to me, your voice sounds like you picked up Texas, or is that Western Illinois? Your
And
dialect.
actually it's Southern Illinois. There
Southern Illinois.
in the South, we have an accent. I'd never really realized it, but many people have told me that I have an accent, and it's actually Southern Illinois, I believe, because a lot of the people Illinois is a long state. We're a whole lot different from Chicago, and down in the down south, it's more like almost like Louisiana or somewhere down in there. It's the way it is down around Cairo and down in the south end of Illinois. It's such a long state. And so I think my accent is more derived from Southern Illinois than anything.
Yeah, maybe culturally more like the Southeast down there than the Midwest, right?
Yeah, right. Yeah, that's right. That's right.
Dr. Way has a question. You're
Hello.
muted.
Hello, my name's Ruben, and I graduated from the department 10 years ago. Thank you for sharing your experience, like over 30 years of experience in less than 30 minutes. And my question is around, like, as a long-time SaaS user, what's your comment on the SaaS, like where it has been, where it is now, and where it is going?
Right. So you got to remember too, I've been out of the game for a little while because as the company grew, I had to be more in management, not so much in SaaS, but it's an amazing story of how far we came, starting when I started at University of Wyoming, which we were still on cards, and then up through time sharing systems and microcomputers. And now of course we can do everything on our phones practically. But I think that SaaS at that point was the leader in SaaS and statistical software. I don't think they are now. I think that these languages like Python and some of these other large data analysis packages have kind of outdistanced them. And also SaaS got into more management type programming stuff. They got into other types of software besides stat analysis stuff. But in the days when they were the heyday, they were so good. I mean, these people, they had some top-notch people at SaaS, and they were thinking about how do I make this usable to users, and it was great. But I really think they've fallen off over the years because they've gotten into so many other things, and the competition catches up with them. They don't have any kind of legal protection over people writing other software programs to do statistical analysis. And also, of course, there's more big data analysis these days. And so I think it's just natural that you're going to have other languages that will emerge that are going to be, available to use. And of course, this open source code was a new thing too. And that's something that's happened just over the last, about 10 years. And so, you can kind of write your own stuff anymore, and you couldn't really do that very easily with SaaS. But it was an amazing thing, an amazing evolution over the time from about 1975 up through the early 90s and the early mid 90s. And they really did a great job. I mean, you look at some of the computing techniques that they used, they really did some really great things. And they had to, because computers were so hard to use at first, and they were getting easier all the time. And so it was really great stuff, but I think it's kind of aged out in terms of what statisticians are going to use in the future.
Thank you.
Dr. King, there's a question in the chat on how is retirement treating you, and do you have any advice on retirement after statistical career?
Well, mine was a little different because with the company, you don't have any choice but to walk away. They want you out because when Genesis bought us, they had their own management and they wanted to run STATKING. Although Rod and I have to laugh about that too, because they'd never run a CRO before. And so they had all kinds of troubles after they took over from us because they had no idea what they were doing. But anyway, yeah. So retirement was good because I didn't really ease out. I was just out. Once I fulfilled, they wanted me to stay on for 6 months. Once I did that, then I got out. And I have a lot of hobbies. I play tennis, I play golf, I read a lot. We travel a lot, and of course with the grandkids and everything. Well, I've not been bored. We had another thing is we hadn't done anything to the house in like 30 years. I mean, we were so busy in those years that we had not remodeled, we'd not done anything. And so I had to supervise all of that. We just got that kind of completed now. But so I've had plenty to do, and I haven't been bored. I think that you do have to have some hobbies, though. I mean, if you're used to working very, very hard and you get out of that all of a sudden, it can be a pretty big shock to your system. That's for sure. Because and most people in stats do work hard. I mean, it's most of the people that we interact with, Marcy, you and I, and we've had a career of working very, very hard. And so when you come out of that, you need to have some hobbies to fall into, or you are going to be bored and have problems, I think.
Very true. A question from James Rosenberger. How have your employees experienced, I guess, the transition under the new company?
Pretty well. They, again, I don't follow things on a daily basis anymore, even though I live right there in town, but they lost a few employees because they loved working with Rod and I, and they left because they didn't want to work with the new management. But for the most part, things have stayed about the same. Now, Genesis has added another CRO just in the last year, and they're going to try to merge those two. And so I don't know how that's all going to play out. But for the most part, I think the employees were pretty happy with the transition. They didn't have like a mass exodus or anything of that sort. And at that point, when I left, we had some of our people that had moved up from the managements of the different departments into the overall management of the company. So I think that helped the transition.
Right. Okay. Any other questions? Anybody in the audience? Or comments, even if you have comments? Yes.
This is Ruben again. So I graduated about 10 years ago, and just among my cohort, like I think most people either go to academia or industry. Like I don't think we have many people that start their own business. Just want to understand kind of the landscape in terms of the consulting now versus like 20 years ago.
Yeah, as I was saying before, I think things have changed from what we used to do in terms of, as I said, there's a lot more big data analysis and more big data type statistical methods. I don't know how that would work these days because you need the computing coupled with it. Before it was more of a advisory thing. Somebody comes in, hey, what designs did I use for this study? And you would help them verbally. But now I think it's become more of a computing issue. And although, again, the small computers can do incredible things, but I think you almost have the computing to go with it. In my early years, most of my things that I did was verbal help. I didn't do it for them. And at A&M, we certainly didn't do it for them. We had too many people coming to us. We would tell them, a lot of times I'd write down on the page, okay, here's the proc you need to run. Here's the code for it. Take it home, do it yourself. They didn't bring us data, and we actually ran it for them. There was no way we could have helped even a tenth of the people that we helped doing that. But so most of my things that in those first few years were verbal consulting. They were just telling them, here's what you need to do, go do it. And so now I would check things out a lot of times to make sure I was telling them the right thing. I'd run in like a test program or something, but for the most part, it was verbal help. And I don't think that's going to be the case today. I think you are going to be doing more of the actual computing and running the data on your own machines.
Thank you.
Thank you. Any other questions?
Can I follow up on the SAS question, because you kind of said their stock has gone down and other stocks have gone up. How do regulatory agencies look at non-SAS, like open source, like R? I think you said Python.
Yeah,
Because I think maybe SAS has an advantage of them over that because they validate their codes.
they do. Yeah, absolutely. Because, you know, most of our business in the last 10 years of the company, we had to validate everything. We had to store the code, and we had to make sure it was stored in repositories that could not be opened by outside people. Only the programmers could get in there. Rod would have to grant access for them to take a program out of the storage, make the modification, and put it back in storage, retest it. We had to track all of that stuff, and SAS does have that advantage. And I think the regulatory agencies like FDA are in a real quandary in terms of what to do, because the other thing is we're moving more to Bayesian methods, and SAS can do Bayesian stuff, but there's packages specifically for that. But how do you try to track that and try to do quality control on it? Yeah, you're right. SAS still has that advantage in that they are trackable and can be placed in quality control systems to make sure that the code's not being messed with or something of that sort. But I think FDA is going to have more guidance on that in terms of, you know, what they're going to allow for the programming for these studies, because it is becoming more of an issue. And open source code is another issue that they have to face as well, because, you know, again, SAS can't just go in there and modify SAS, but you can with some of these other languages. And I don't know how that you track that. That's going to be a very difficult thing for the regulatory agencies, I think.
Okay, great. Thank you. Any other questions or comments?
I guess I have another one. This is kind of unrelated to what we've been talking about, but more of a going back. You said that Mike Longnecker was your PhD chair. Did he ever get you out running with him? He likes to.
No, but he and I still play golf all the time. In fact, I'm going to be in College Station tomorrow to play golf with Mike. Yeah, I'm not a runner. My daughter, my youngest daughter is a big runner, but not me. I'm a walker.
Well, when I was there from 96 to 2000, and he would go out for lunch year round, noon.
That's right.
No matter how hot it was or how cold.
I know. I know. He's an amazing character.
All right. There was another comment, I guess, in the chat, just thanking you for sharing your unique career opportunity.
Sure.
Any others? Yeah, it's been an awesome presentation. And like I said earlier, I think it's very useful for especially those who are young in their careers to see, you know, how your career path grew, you know, from the early days to 30, you know, plus years later.
Yep. Yeah, that's right. It was an interesting trek.
Just piggyback on something you mentioned earlier. Your wife, Dr. Eileen King, she did give a presentation also to this group, the Statistics Former Student Network, and her presentation should be available on the SFSN webpage if anybody wants to go back and watch that presentation. If you missed it before, it might be useful to check it out. Sounds like we pretty much wrap things up here. I appreciate you all coming and listening to Dr. King, and Dr. King for sharing your career experience. It's been enlightening, I think. Like I said, it triggered some of my personal memories. I hope everybody has a great day, and invite you all to participate in next month's presentation on the May 5th. It'll be published here shortly. Sorry, May 1st, I apologize. Thank you. Have a great day.
Okay. Bye, everybody. Thank you.